The normal frequency of bowel actions varies greatly between people. Ideally, you should have from 1 to 3 bowel actions daily. They should be a brownish color, soft, have a grainy texture, and pass without undue straining. They may contain obvious pieces of undigested vegetables, such as small parts of plant skins and small parts of leaves. This is a good sign because this increased fiber acts like a broom to cleanse the bowel walls. Signs to worry about are red blood in the stools, a black color of the stools, or an obvious change in bowel habits. It is good to look at each bowel action after you pass it to check for general appearance and color. If constipation becomes chronic, waste products and feces will accumulate in loops, pockets, nooks, and crannies in the bowel. In such places, unfriendly bacteria and parasites may grow, and this can cause a buildup of toxins. Toxins from the bowel may recirculate back to the liver. An overworked liver causes fatigue and poor general health. The bowel may become inflated, causing abdominal bloating, cramps, and unpleasant gas. And this is embarrassing for many people. If you have these problems, it is wise to have a colonoscopy to exclude serious bowel disease. Chronic constipation can lead to hemorrhoids and anal fissures, which are painful and can bleed, producing bright red blood. Constipation can lead to pockets in the bowel, which may become inflamed. This is known as diverticulitis. Repetitive straining to pass hard feces can lead to a prolapsed rectum and/or fecal incontinence. Laxatives are used to induce a bowel action and/or to prevent constipation. Strong laxatives. Some laxatives are very potent and may overstimulate the muscles of the bowel, leading to irritation and spasm, which in the long term may cause permanent damage of the colon. For this reason, strong laxatives should not be used on a regular basis. Strong laxatives, also known as cathartics, can be used occasionally for severe constipation. They include senna and cascara. Other laxatives include phenolphthalein and dioctyl sodium sulfosuccinate. And although they work swiftly, they can cause diarrhea and cramping. Strong laxatives can be habit-forming and are best used for occasional use only. Osmotic laxatives draw water into the colon and make the bowel action soft and more liquid. They do not generally irritate the bowels and can be safely used on a regular and even daily basis. There are several subgroups of osmotic laxatives, namely saline, magnesium as oxide or hydroxide, and sugar alcohols. These include lactulose, propylene glycol, and glycerine. My favorite osmotic laxative is magnesium, which works in specific forms: magnesium sulfate, Epsom salts, magnesium oxide, and magnesium hydroxide. Epsom salts are unpleasant in taste, and the other forms of magnesium are much more palatable. Magnesium is not a sugar alcohol and thus is not likely to cause bloating. Propylene glycol, found in Osmolax, Pegalax, and Movicol brands, is listed as generally recognized as safe GRAS for use as a direct food additive by the U.S. Food and Drug Administration. Propylene glycol is a sugar alcohol and can cause bloating, cramps, and gas in those with intolerance to FODMAPs. Lactulose, also known as Dufalac, is a synthetic, non-digestible, sugar-like agent, not to be confused with lactose, the sugar found in milk. It is also a sugar alcohol that can cause bloating. Osmotic laxatives increase the water content in the bowel, making the feces softer and easier to pass, so they can be used for children over 4 years of age, as well as adults. Suppositories and enemas are effective for severe constipation or fecal impaction. Some bowel therapists add the herb catnip or coffee to enemas to improve their cleansing effect. Fecal impaction means that hard feces get stuck in the rectum and lower colon and obstruct the passage of softer feces higher up. This can lead to spurious diarrhea, where the softer feces above the hard impacted feces liquefy and are able to pass around the hard feces. It then appears as though the patient has diarrhea, when in reality, they have severe constipation. This can occur in the very elderly, immobilized persons, over-medicated patients, or those with neurological diseases. This is why a doctor should perform a rectal examination in severely constipated patients. Fecal impaction may require manual extraction of the feces if an enema does not work. Thereafter, regular enemas or colonic irrigations may need to be given to prevent a recurrence. Many people find that colonic irrigations are very beneficial in removing waste products from the bowel and in experienced hands this is safe to do. If you have severe constipation, colonic irrigations from a registered practitioner every 2 to 4 weeks can be of great benefit. However, even if you have regular enemas or colonic irrigations, you still need a high-fiber diet and plenty of water, and if possible, regular exercise. Enemas and/or colonic irrigations should not be performed in cases of inflammatory bowel disease, severe diverticulitis, or where there is a structural defect of the bowel. This is to avoid mechanical damage to the bowel in these cases. A high-fiber diet is best obtained from eating plentiful vegetables and fruits, grinding linseeds, flax seeds, sunflower seeds, and almonds into a fine powder can help stubborn constipation and can be eaten instead of bran. This powder mixture is known as LSA and can be purchased from supermarkets and health food stores, or make it yourself in a grinder and store it in the freezer. Chia seeds and hemp seeds are excellent for constipation and reduce bowel inflammation. Add them to smoothies or gluten-free muesli. Hemp and chia seeds can be eaten regularly in salads and smoothies and are excellent for constipation. You do not need to grind hemp seeds or chia seeds as they are soft and easily digested. Fiber products can help constipation, and the best-known one is psyllium husks. An excellent gluten-free fiber product is called Fibertone. Fibertone is a superfood for the bowels. The dose is 1 or more teaspoons of Fibertone powder daily on cereal or in smoothies, juice, or water. Fibertone is suitable for all types of constipation as it acts like an intestinal broom, sweeping the walls of the colon clean. Make sure that you drink plenty of pure water, 2 liters daily, to help this powder do its work. Fibertone can reduce irritable bowel syndrome and chronic constipation. It can also reduce bowel toxicity caused by fecal stagnation. Fibertone is also suitable for those who are allergic to gluten, found in wheat, oat, barley, or rye.